Hello, welcome to ANE community. In this particular video, we are going to discuss the concept of Upashaya, which is one of the important aspect of Nidana Panchaka or Roga Pariksha or Pancha Lakshana Nidana as per Ayurveda fundamentals. The two Roga Nidana fundamentals. When you think about the term Upashaya, that is being mentioned by Charaka Samhita, that is Upashayaha, Punaha Hetu Vyadi Uparitanam, Uparitarthakarinam, Cha Aushadhahara Viharanam, Upayogaha Sukhanubandaha. So that is, the Upashaya is the one which is actually helpful for Sukhanubandha. So that means which will be considered as the beneficial to the human body. So that will be of Hetu Vyadi Uparitarna. So that may be either which may be opposite to the Hetu of the disease, or it may be opposite to the Vyadhi, or it may be uh, opposite to Hetu or Vyadhi, or otherwise which may be having the features or the uh, that is Uparitarthakarinam, that is which is having the features similar to that particular Hetu or Vyadhi as such. That may be of further three subcategories. That may be in terms of the Aushadha, that means the medication. That may be in terms of the Ahara, that means it may be food substances, or that may be in terms of the Vihara, other regimen factors. In other words, by doing into these different aspects, so that is by trial and error, we are going to identify the diagnosis of the disease as the person may be suffering from this particular disease only. So for that, the Madhava Nidana says the similar description, that is Hetu Vyadi Viparyasta Arthakarinam Aushadharna Viharana Upayogam Skavaham Vidyad Upashayam Vyadeh Sahisatmamiti Smrtaham Vipirito Anupashayo Vyadhyasatmyabhisamnitah. So that is the description is same. So the Upashaya are those which are actually helpful in the improving the clinical condition, which may be in terms of the opposite to the Hetu, or it may be opposite to the Vyadhi, or which may be having the features similar to the Hetu, or which may be having the features similar to the Vyadhi. So that is considered to be the what do you say, that Upashaya itself. It is having the synonym Satmya. Whereas the ones which are considered to be having the opposite function of Upashaya, that is considered as Anupashaya. So that means which is actually worsening the clinical condition, which is again termed as Asatmya. So here the Ashtanga Sangraha, it also says the same thing. Upashayo hetu vyadi viparitaihi viparita arthakarina viparita arthakaribihi cha aushadhaha raviharehi sphanubandha sahi vyadi satmya iti samnyah tad viparito anupashayah. Further he says deshakalo vyakhyatau. Aushadha, Ahara and Vihara he has mentioned three types. Further two more are being mentioned, Desha and Kala. As far as types are concerned, Ashtanga Sangraha Nidana Sthana, that is saying Desha and Kala to the types of the Upashaya, whereas Madhava Nidana says 18 types of Upashaya. So that is Viparita Upashaya and Viparitarthakari Upashaya. So Viparita Upashaya in the sense the ones which are having the semi opposite to the quality of either Hetu or Vyadhi, or otherwise Viparitarthakari in the sense where the Upashaya which we are going to use, that will be having the similar qualities of Nidana and Vyadhi. It may be having the similar qualities of Nidana as well as Vyadhi. Here, different examples are being mentioned. First of all, let us look into the Viparita Upashaya. So that is the here the examples given in Madhukosha commentary, they are Hetu Viparita Upashaya. So that is, we are going to use the use of Shunti in the patient who is suffering from Vata Kafaja Jwara. So Shunti, which is having the Ushna Guna, and Vata Kafaja Jwara, where this is being produced by the Shita Guna. So that is actually helpful in the minimization of the symptoms as such. As far as Ahara is concerned, use of Prasaudana in the patient who is suffering from Shrama Anila Jajwara. So that is Prasaudana, that is Mamsa Rasaudana. So where the person is suffering from Shramajanya Mahataja Jwara. So that is again the which is the main hetu is Shrama, which is leading to the Vata Prakopa, wherein we are going to use the Mamsarasa Ahara. As far as Vihara is concerned, Ratri Jagarana in the person suffering from the Kapha Prakopa, which has developed due to Divaswapna. So here the main hetu is Divaswapna, induced Kapha Prakopa, and here we are going to use the Vihara, that is Ratri Jagarana. As far as Vyadhi Viparita Aushadha is concerned, use of Patha in the patient suffering from Atisara for the purpose of Stambhana, that is the Aushadha here. Example, use of Masura in the person suffering from Atisara. Again, the purpose is Stambhana. So here in the earlier case, it is the Patha which is being used as Aushadha. Here, Masura, which is being considered as the food substance, that is being helpful in the Stambhana purpose. Whereas the Vihara is concerned, Pravahana Chikitsa. So that is who is suffering from Udavarta. Udavarta in the sense where the person will be having the Pratiloma Pravritti of the Apanavata or Samanavata, and later there may be a possibility of Pranavata also. In that particular sense, Pravahana, we are going to do the straining, wherein the movement of the Vata dosha will be happening in the downward direction. So that is Vyadhi Viparita Vihara. In case of the Udavarta, it is the Pratiloma Pravritti. We are going to do the Pravahana, wherein the Anuloma Pravritti of the Vata can be facilitated. For that purpose, Pravahana Chikitsa is being performed. As for a Hetu Vyadhi Viparita, the example is use of Dashamula. The patient is suffering from Vata Jashotha. So wherein the Vata is considered to be the main reason, Hetu, and Shotha is considered to be a Vyadhi. So here you are using the Dashamula to have the pacification of the Vata as a Hetu, Shotha as a Vyadhi. So here it is an example for Hetu Vyadhi Viparita Upashaya. Whereas Ahara, use of Yavagu in the patient suffering from Shita Pradhana Dwara. So that is, so here the Hetu is Shita Pradhana, Vyadhi is Dwara. We are going to use Yavagu, which is having the action opposite to this because of its Ushna Guna and Dwaragna action. As far as Hetu Vyadhi Viparita Vihara is concerned, Ratri Jagarana, the person suffering from Tandra as well as Kapha Prakopa. So here the Kapha Prakopa is a cause, Tandra is a Vyadhi, and we are going to use the Ratri Jagarana. As far as Viparita Arthakari Upashaya is concerned, so here we are going to use the similar Hetu. That is, we are going to use the similar Hetu, which is actually responsible for the slight increase, but which is actually responsible for the pacification of the disease itself. The same principle is being used in the fundamentals of homeopathy. So that is Hetu Viparitarthakari Upashaya, wherein we are going to use the Ushna Upanaha in the person suffering from Pittaja Pachamana Shotha. That is, the person is administered Ushna Upanaha, that is, the warm poultice to the area which is having the Pittaja dominant Shotha. So that is Hetu Viparitharthakari Upashaya Aushada example. As far as ahara is concerned, consumption of vidahi ahara in the person is suffering from pittaja, shotha as such. So that is the consumption of vidahi ahara. So that is the substance which are being fried in sarshapataila, etc. That is considered hetu viparitharthakari ahara. As far as vihara is concerned, giving santrasana. That means we are going to make the person to have a fear, specifically in the person suffering from vataja unmada. We are actually responsible for the vata prakopa, but here that will be used as the upashaya aspect. That is hetu viparitharthakari vihara as such. As far as vyadhi viparitharthakari aushada, use of madana phala in the person who is suffering from chardi. So that is chardi as a user disease where the person is having the pratiloma pravritti of pranavata. But if you are using madana phala, which is again inducing the pratiloma pravritti of pranavata. So thereby, which is being considered as an example for vyadhi viparitarthakari aushada. Whereas the vyadhi viparitarthakari ahara, that is administration of kshira, which is considered to be virejanakari, in the person is suffering from atisara. Atisara itself is considered to be the disease where there is ati pravritti of the jala from the adhomarga. We are using the kshira, which is having the virechana karma, which is again having the similar effect, that is in the same direction itself that will be moving. So that is what is considered to be the example for vyadhi uparitarthakari ahara. Whereas use of pravahana for the purpose of vamana, the person suffering from chardi. So here pravahana, it is done in the reverse direction. We are inducing or we are giving the pravahana. For example, keeping the hand over the tonsils or the over the pharynx, oropharynx. So that is what is considered to be the pravahana chikitsa. So here vyadhi viparaitarthakari vihara here. Hetu vyadhi viparaitarthakari upashaya. Use of aguru vadilepa. So that is aguru, it's the drug which is having the ushnavirya. If the person is having the agni dagda, so that means burn injury, then using the aguru vadilepa is considered to be an example for hetu viparaitarthakari aushadha. Use of madakari madhya in the person who is suffering from madatyaya. So that is, he is having the madatyaya. You are giving the madhya to drink, alcohol to drink. That is, it is considered to be the similar quality of the hetu and vyadhi. So that is use of madhya. That is a ahara aspect. As far as vihara is concerned, prescribing vyayama who has suffering from mudhavata because of vyayama. Because of vyayama, there is a vata prakopa. Still, you are giving the vyayama to a lesser extent. That is an example for hetu vyadhi uparitarthakari upashaya. The vihara example. As far as its significance is concerned, gudalingam vyadhim upashaya anupashayabhyam pariksheta. So, that is, its use is to identify the disease which is having hidden clinical features. For example, if the person is suffering from knee joint pain and you are administering the oil, and if the person is having the worsening of the symptoms, that is aggravation of the pain on administration, on application of the oil, that is considered to be the person may be suffering from amavata. Whereas application of the oil and the person gets the relief from the presenting complaint, that indicates that the person is suffering from sandhivata. So, amavata, where there will be kapha dominant feature, application of oil, which is having again the kapha dominance, snigdhata, etc., that will be worsening the situation. That is the amavata as such. Whereas sandhivata as such, that is usually considered to be vata dominant, and application of snigdhata will be improving the situation, that is Vatakshaya may take place, so thereby the person will be getting the improvement. Take home messages from today's discussion are: Upashaya is a type of Nidana Panchaka or Roga Pariksha or Pancha Lakshana Nidana, which is considered as trial and error method, which is actually helpful in confirming or rejecting the clinical diagnosis. As far as Madhava Nidana is concerned, 18 types of Upashaya are being mentioned, whereas as for Ashtanga Sangraha, 30 types are being mentioned, wherein the 18 types of Upashaya are further Aushadha, Ahara, and Vihara in terms of Viparita and in terms of Viparita Arthakari Upashaya are being explained. Whereas Ashtanga Sangraha says Desha and Kala along with Aushadha, Ahara, and Vihara. Its main use is in identifying the Udalinga Vyadhi or the clinical features which are very difficult to identify. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of two Nidana learners so that we can make a huge movement for this particular small message. That's all for today. Something more in the next video. Thank you.